Hi guys, welcome back. We're here for part 2 of CoolSculpting with Tanya and her patient Virginia. So we are about 3 minutes away from taking off the applicator, but we got some anonymous questions that we're going to ask Tanya so we can get them answered. Okay, Tanya, we are back.
Welcome back. I'm so glad that you guys are tuning in. This is kind of the most exciting part of the whole thing. It's the most exciting part for me. I love taking the applicator off and seeing the expression on everyone's face when they go, oh my God, that was in there? And yeah, it's really cool. So we've got a little less than 2.5 minutes to go. I'm going to turn this little alarm off. This alarm lets me know I kind of step out of the room when you guys are having treatment and I know you're really comfortable. So I step out of the room. You guys can watch your Netflix. You can take your naps, get on the phone. We have Wi-Fi at all of our offices. So it's really kind of chill, no pun intended. And you can do your thing, and then whenever it's time for me to come back in, we will turn the lights on and get you ready for your second session, or if you're done, you just kind of pick up and go home. So we have 1 minute and 54 questions. We have a list of questions that actually came in through the messenger. I guess some anonymous questions. People didn't want to, put the comments in the comment
Not everybody
section.
wants to share that they want to freeze their fat,
really
but we know you
do.
do.
And I encourage those. So Sophie, let me know what those were, and I'll kind of start tackling those.
So one of the questions, I actually got this more than once. What should you expect following the treatment? Is there any downtime?
Okay.
The days following? Is there pain? What should people be expecting once the applicator's off?
You guys are going to see that right now. So that's a great question because you're going to see it in real time. But basically I'm going to take off the applicator. It's going to leave sort of a suction imprint of what was inside the applicator being treated or being frozen. And then I'm going to massage that. And that part can be a little bit uncomfortable for the patient. It's almost like if you have a bruise and then I sit there and start rubbing on it. It doesn't feel so great, but it's not super painful either. The body is going to take about maybe 5 or 10 minutes to completely warm up the area that was just treated. And then once it's back to normal body temperature in that spot, you kind of don't feel much of anything. The area goes completely numb. And it's going to stay numb for a couple of weeks. And in some cases, I've had patients that have said they've been numb up to 1 month out, which is great. And you're going to start to see the results from your treatment as early as 2 weeks, but the norm for most patients is about a month. Okay, so those results start to show at a month. They're not finished at that time. So I've had.
When are they optimal?
Optimal is about 3 to 4 months out. 3 to 4 months out, the fat cells are completely eliminated. Your skin is already starting to tighten down where that fat was. You're not left with any loose or floppy skin, so it's really cool. And you kind of just go home and go about your business. If you guys are really athletic and you want to work out, feel free to hop into the gym as soon as you're off the machine. There's no restrictions, no downtime. So that little sort of beep that you heard, my treatment is complete. And
we are ready.
Let's take off some clothes. So,
oh no, my cozy bag.
I know. I have to get you out of your little cocoon.
Sorry.
So, remember I was saying earlier, look at how this thing is kind of just stuck here.
Yeah.
Right? Okay, so let's turn off suction. And I'm going to kind of peel it off very gently.
Let's see what we have here. We've got some more questions coming in now, Tanya, actually, but let's see what this looks like.
Boop. There we go.
Wow.
Right? Look at that.
Whoa.
So
that's
like,
what was inside of there.
That's what was treated. So really we covered this whole section here. It looks the most intense right here. I'm going to start to massage.
Oh, okay.
So it feels like a bruise.
Yeah, it feels just like exactly that, like a little bruise, and but not like a really bad.
Not like a really.
Is it like really uncomfortable and painful, or it's just?
No. It just feels like a bruise.
Yeah, like she's massaging a bruise.
Yeah.
Good. So this actually grabbed a little more than I was expecting. So it got a little more skin on the bottom, which is good. It got up to my marking here. I like the position of it there. So now I'm just going to kind of work this out. So we're going to do this.
You're making a cake. You're like a bread, and you're like kneading the dough.
Yes. I'm an excellent baker.
So Tanya, we have a viewer who wants to freeze her fat, but she has kind of a combo question.
Sure.
Which multiple anonymous viewers as well asked.
Okay, so this is a repeat question.
Yes. Good. Will it stay away? Is it permanent?
Yes. CoolSculpting is permanent. Oh my God!
Yes, that's exactly what we want to hear.
Yes. What's really good about this, it is completely permanent. Now, I'm going to be cautious when I say this. This is the only time I would ever compare CoolSculpting to surgery. It's permanent in the sense that it's like a surgery. It's like a liposuction. That fat is not coming back to this area. I do have a lot of people that have a misconception with, okay, I've had lipo or I've had CoolSculpting and the fat ended up going somewhere else. Only if you gain weight. So if you gain, and it's got to be a good 15-20 pounds, okay, you're going to see that fat come to a new area. I'm going to share.
That was actually the combination question that our viewer had.
Perfect.
She wanted to know what if she gains a little weight, and I actually had that question personally from the last treatment that you did on me. What if I gained a little weight in my abdomen again? What's it going to look like?
You're not going to see it in the area that was CoolSculpted. Very similar to liposuction. If you get liposuction somewhere, you're not going to see it in the area that was treated, but it will go to other parts of the body. It'll evenly distribute. I have an excellent example myself. I had done CoolSculpting before I got pregnant, before I got married, so I had treated my abdomen. That was the only area that really bothered me. Then I got pregnant, so I was like, I wonder what this is going to do to my body. You know, since I do this all day, I wanted to see how my experience was going to be. And to be completely honest with you guys, after having the baby, my stomach was not the issue. With the pregnancy, weight gain of about 15-20 pounds, I noticed that I had some rolls on my back. So I was like, okay, that's exactly what I tell patients and what's expected to happen. You're going to get fat in other areas. So what did I do? I treated my back. CoolSculpting is a little bit addictive, you guys. That's the only down thing that I can say.
She's not lying. It's addictive. But so what different areas of the body can you pretty much do this anywhere? Or because you're mentioning going straight for the back when you saw it. So
but anywhere that there's a good amount of fat. So I'm going to start from the top down. You can treat the chin. You can treat the little arm fat that we get here next to the bra. You women know what I'm talking about. Guys are like, what is that? You can treat your upper abdomen, your lower abdomen. You can even treat what we call the mons pubis, which is basically the area below a C-section scar. Okay? You can treat the upper back, the mid back, the lower back, or what we call the flank. You can treat your arms, you can treat your inner thighs, you can treat your outer thighs, and with the Cool Mini, we use it off-label. You can treat the knees. If somebody has a really kind of a fatty knee, you can treat that as well. So there's a whole bunch of places that you can use these applicators, and there's different shapes and sizes depending on the area that you want to treat. Okay?
ladies, you can even treat your banana rolls right under your booty.
I forgot about banana rolls.
Oh, I did not because I want to do it.
A lot of you guys are like, what is a banana roll?
What is a banana roll?
What is a banana roll? A banana roll,
we're going to tell you.
It is that little fat that tends to like hide right under the butt. So it's part of your upper thigh behind your butt, right? But it kind of like is a little section of fat back there. So CoolSculpting is so amazing for that area because I don't want to say it makes your butt look amazing, but it actually kind of...
It makes it look perky.
Yeah, you're getting rid of that sort of distraction that's making the butt kind of sag downwards. So it's not for everybody. You got to come in and see me so I can take a look at you guys and determine what's going to be the best area. Are you feeling anything right now? It's kind of numb, right?
It's a little numb, but it feels a little dab, like a little tiny sore.
A sore. Perfect.
But like a bruise, but not like...
So I don't know if you guys can see. Come zoom in here. So this is what we were able to really cover, this whole section of fat that's there.
That's a
and then if I point here, this is probably going to be a little bit of a hickey mark that you're going to see. It's very light. So a lot of patients have also asked, does it bruise? If you're on blood thinners, we can still treat you for this. We have to be cautious. I need to know exactly what blood thinners you're taking and how much you're taking. But I have treated patients in the past very cautiously, and you will those patients will bruise. Okay, so it's kind of something you want to discuss before you even consider having treatment. But if you've gone out drinking the night before, I've had a few patients do that. If you're on aspirin or you take things like that, fish oils, anything that's going to maybe cause some potential bruising, you might have it after having CoolSculpting just because of that suction pressure. It'll cause like a hickey mark on your skin. Okay?
How long does the hickey last?
A couple days, maybe. Okay. Yeah. I mean, this is really not bad at all. It tends to be at the ends of the applicators where the pinch is kind of tight. It's kind of tight. So we have more questions. I'm just going to kind of keep going, okay, and start to get her ready for the other side. So what are the other questions that we had?
Well, we covered all the anonymous questions that we had,
okay.
But a couple questions for Virginia. How was your experience as a whole? What was it like sitting there with the applicator? Were you ever uncomfortable?
No.
Be honest.
No, I'm being honest. Like the first initial pinch, I'm not gonna lie, was like off-putting. Like I'm like, okay, is this gonna be the whole hour? Because it was like a nice pinch.
Yeah.
But I'm not kidding, like a few minutes in, I forgot it was there, and then once she got me all cozy and I started watching Netflix, it was like nothing.
That's amazing.
Yeah, I didn't really, it was not a big deal
Here
at all.
comes the
And
cold
this is
again.
the cold part.
Here we go, cold.
See, Virginia is a pro now. Now that we've done one side, this other side is always so much easier for patients because they're like, oh, yeah, that's the gel, that's the suction. All right, 10 minutes has gone by, I'm fine. You guys kick me out of the room on the second hour.
She's not lying. Once you get used to it and you know what to expect, that totally happens.
Yeah.
I can attest to that.
I got used to it pretty quickly, like that pinch.
Yes.
Yeah.
I know this is going to sound kind of crazy, but people, please be very cautious. I've had a patient that came in to see me, and it was a gentleman actually, and he admitted to me that he had tried doing some ice treatments on himself at home before he came in to see me for consultation for CoolSculpting. Just because it sounds really cool and it's like, oh, well, I'll just put ice on my skin. Please don't do that. So definitely this is a different technology. This is a, there's a patent with this company. They've done their homework. It's Harvard-based, medicine. There's been a lot of research. Another kind of medical question that I've had patients ask on occasion, you can have this done and then go see your doctor for labs the next day. There's not going to be any increase in your blood lipid level. So your cholesterol is not going to spike because we have treated your abdomen with CoolSculpting. So just to kind of touch on that for a little bit, just be careful out there. Don't do anything crazy.
Yes, on the topic of safety, if you all are looking into CoolSculpting, make sure that anywhere you go, you make sure that it is the FDA approved CoolSculpting from Zeltique. There is counterfeit machines out there, and the counterfeit machines, you don't know really, the research is just not done on them, and they're basically copies of something that has been researched and tried again and very successful. So just please be careful out there. Or just come see us and we'll take care of you perfectly.
Yes. Consultations are completely complimentary. So it's a great opportunity just to hop right in. The paperwork takes a few minutes and we'll look at you. I will kind of pinch you and squeeze you and see what we can treat and what we can't. And I'll be completely honest with you if it's something that we can do or not do. Okay?
Amazing. And we have one last question that I'm going to touch on for you guys. So we did have somebody ask how much the treatments cost. So like everything else, it varies by patient, varies by the area, varies by how much you really want to get CoolSculpted. But it varies anywhere from $750 to about $1,500 a treatment. However, since we have such loyal and amazing Facebook friends, we have a special surprise for you. So if you call and set up your appointment and you mention that you saw us on Facebook Live on the CoolSculpting video, we will have special pricing for you, but shh, it's a secret. Only our Facebook followers are going to see this, and only our Facebook Live viewers are going to get that special pricing, so we can't really tell you what it is until you call. So give us a call, and we can't wait to see you and help you freeze all that fat off. See you soon. Thanks for joining.